are working endlessly. My team and I, the Social Health Authority, the Digital Health Agency, among others, to ensure that Tifa Care is going to be implemented countrywide, and we'll have the fruits, people seeing the benefits of Tifa Care. So far, we've had more than 500,000 Kenyans having benefited. We've been able to pay various healthcare facilities that have again provided health services. And yes, we've had a few challenges, some of them being the system interruption challenges. But as you are all aware, like in the mobile banking industry, even when you look at other countries like UK, the NHS system, other systems in Canada, etc., system interruption is common. Even as you go into your Google, you'll notice that system interruption is a challenge. But let us see where we are coming from as Kenya. We had very few people having had NHIF. Now we have more than 18 million Kenyans, almost three times the number that was in NHIF. And again, we are looking to, have more Kenyans on board. The whole, almost 100%, that is Tifa Care on board. So there are people in Kenya who could not access services. That is where we are coming from, So the problems of system interruption, yes, and we are addressing them expeditiously. We are happy that we now have the server that came in on Friday, and now they are working to the technical issues to ensure that it's working efficiently. And what we can say, yes, during this time, bear with us, but ultimately, if each and every Kenyan can be able to access services, whether you are rich or poor, I believe that this would be, a game changer for all of us as Kenyans. Because when you look at other systems, they have everyone accessing care. That is the bare minimum. That is the threshold. Then after that, now we can review the concerns of waiting time, system challenges. But for now, accessibility, affordability, and quality is really critical so that all of us can access care. And so what we are saying is we are addressing the issues, the referral mechanism. We are going around every county, identifying each and every challenge that they are facing. We are escalating it up. We are ensuring that everyone is on board. Our technical team is working, endlessly to review the challenges. And again, we are working with other ministries, including to ensure that we have the national identification cards so that people can access services, among others, to lung conditions which can lead to hypertension, etc. And so we are deliberating with the Tobacco Board to ensure that there are funds that are allocated to manage this. Equally, we look at rehabilitation and how the people can be rehabilitated and again integrated into the community so that they can continue with their lives. We are also visiting various facilities right from level 1, that is household community level 2, 3, 4, and 5 within this area of Laikipia County to see how UHC implementation, that is Tifa Care implementation, is ongoing, if there are any challenges that need to be addressed and worked on expeditiously. And first of all, we visited the maternal center, but we look into visiting the various facilities, especially the level 5 currently, to see how we can be able to address the concerns so that we can have a full implementation. We are also working with the governor, working with the government here, the local government, to review the challenges that have been highlighted. Some of them we have escalated, and some of them we are working together with the SHA team, the digital health, to ensure that a seamless implementation of Tifa Care. And so we thank the governor for hosting us. We thank him for the optimism that he has in matters of implementation of Tifa Care. We also thank the community, the patients that we have seen. We are seeing that the registration is ongoing, and the challenges that have been identified include the identification cards. We'll be very honest, seeing that Some are from the nomadic setting. They are coming into facilities without identification cards. And so we'll be engaging with the various ministries to ensure that there's prompt issuance of identification cards. And that way we can have our patients also benefit from the Social Health Authority.